What is dry needling, and how does it relieve muscle trigger point pain? In the preceding scenes, we discussed how normal muscles undergo contraction in response to release of a burst of acetylcholine from the muscle end plate of a motor neuron, and how damage to the end plate can result in small erratic bursts of acetylcholine that cause many end plate potentials in only one or several fibers, resulting in localized contractions and damage to these fibers to produce muscle trigger points. Finally, we discussed how muscle trigger points produce severe chronic pain. In the previous scene, we listed the various treatments that have been used to relieve the chronic pain associated with muscle trigger points. One of the most common methods to treat muscle trigger point pain is by ingestion or injection of pain suppressant and anti-inflammatory drugs. But such drugs are powerful with frequent unpleasant side effects and the potential for causing drug dependency. Later, it was discovered that the insertion of needles into muscle trigger points could relieve myofascial pain, whether accompanied by the injection of pain-killing drugs or not. This finding suggested that it was the insertion of the needle into the trigger point that stopped the pain, not the administration of the pain-relieving chemicals. Since then, what is now termed dry needling has become a treatment for chronic pain performed by physical therapists. Here we see an example of a physical therapist performing dry needling on a patient. The therapist palpates the skin until the trigger point is determined by the presence of a lump and taut band in the muscle, accompanied by possible presence of redness and heat on the skin surface. The needle is manipulated within the trigger point to stimulate the muscle to grasp the needle in a local twitch response. The local twitch response indicates the release of the trigger point, and in some cases pain relief is immediate. Whereas acupuncture is performed by needling all the acupuncture points of a meridian, dry needling is performed by insertion of a single needle into a painful trigger point in a muscle, and is not intended as a treatment for malfunctioning internal organs. Successful dry needling is a function of the skill of the therapist to find the taut bands and discern the location of the trigger point knot to precisely place the needle for maximum effect. The neurophysiological mechanisms by which dry needling relieves myofascial pain are not yet defined, but several physiological changes are noted and suggest modes of action. Here is a muscle example with two trigger points, a tight knot and a loose knot. In this case, the needle directly breaks the dysfunctional motor end plate in the tight knot. Rotating the needle rolls the myofascial connective tissue onto the needle and stretches the connective tissues and associated fibroblast cells. Stretching activates fibroblasts to synthesize and release pain-relieving chemicals such as adenosine. It should be noted that the collagen fibers that comprise the fascia become aligned by the stretching. Recent research has shown that this reorganization of the molecular composition of the connective tissue also has a pain-relieving action. The stretching, along with moving the needle up and down, may stimulate a local twitch response, which is believed to be a stretch reflex of the taut bands mediated by the spinal cord and can be felt as a grasping of the needle. The local twitch response is indicative of a successful needling for pain relief. Disruption of the knot relieves the taut bands and allows the muscle to relax, stretching the loose knot. Blood flow returns to normal and oxidative metabolism resumes so that ATP is produced in the loose knot, which allows myosin to release from actin and relax the contracted sarcomeres. The broken ends of the needled trigger point likely die and deteriorate and are replaced by myoblast cells which differentiate into a new fiber. Biochemical measurements confirm that shortly after dry needling, the inflammatory and pain-inducing chemicals disappear from the trigger point, and the chemical microenvironment returns to that of a normal muscle, relieving the irritation to the nociceptors. Recent studies of dry needling trigger points in mice have shown that the broken fibers and the motor neuron and end plate are regenerated and functional again a week after needling. Let us look at the effects of needling on the pain events taking place in the dorsal horn. Here is the central nervous system and the vertebra that receives input from the trigger point. Looking at a cross-section of the vertebra, we see the dorsal horn. Here is a close-up of the dorsal horn.